Hi, and welcome to the lecture on intervening during crisis. Some objectives. You can read these on your own and make sure you use these as study tools. Okay, so let's define crisis. Crisis is a sudden event in one's life that disturbs homeostasis, during which usual coping mechanisms cannot resolve. So we know this in terms of the transactional model. Stressors create anxiety, and in crisis, you actually get a really up front in the line ticket to panic level. It happens very, very quickly. So any stressful situation can precipitate a crisis, and assistance with problem solving during the crisis period, it preserves self-esteem and promotes growth with resolution. So again, reinforcing with you that when you're dealing with people in crisis or emergent situations, remember you're not going to be with them all the time. So you need to do some quick assessment and see where they're at with their coping and when you can help with their own problem solving. So you're helping them help themselves. Next slide. So let's look at the characteristics of a crisis. Just reading the bullets here. Crisis occurs in all individuals at one time or another. I think you might agree with that. And is not necessarily equated with psychopathology. So you can have crisis and you can basically get over it. You move forward. Okay, and there we go. We all experience this. This means anybody can be affected. And really, I know if you haven't been affected, I really need to talk to you because there's really not a person around that hasn't been affected by crisis. Okay, crises are precipitated by a specific identifiable event. Definitely you can see that. It's usually a sudden problem you're really not prepared to deal with. Crises are personal by nature. What may be a crisis to you may not be one to me. And we've discussed things like that in terms of when maybe an item is misplaced. Some people will freak out over it, whereas others say, hey, that's not a big deal. I'll look for it tomorrow. Crises are acute, very sudden, not chronic, and are usually resolved in one way or another within a brief period of time. A crisis situation contains the potential for psychological growth or deterioration, and that's again at the transactional model in terms of getting help when your internal coping skills are not there and you need external help through support people and what have you. One can deteriorate by the effects of crisis. 4 phases of crisis. Number 1, the individual is exposed to a stressor. And think about that. What can those be? When previous problem-solving techniques do not relieve the stressor, anxiety increases. Again, we are appraising these situations and making a determination if it's something to worry about and continue to stress about and get anxious about, or is it something we can just kind of let go. And in terms of crisis, as a crisis worker, you, the nurse, you might be equally affected here too. And in your role, you have to put it away and deal with it another time. That could be a problem for some people if they don't do that effectively. Okay. All possible resources, both internal and external, are called on to resolve the problem and relieve the discomfort. That's where you come in as a crisis worker, where maybe other treatments and interventions might work as well. If resolution has not occurred in previous phases, the tension will mount beyond a further threshold, or its burden increases over time to a breaking point where one just can't take it. Major disorganization of the individual with drastic results often occur. So the bottom line is people need to get help and process. or else they're going to kind of spin and spin and spin in almost an out of control phase. Okay, next slide. Just because there is a stressor, will there be a crisis? Well, again, let's review what I've already been saying here. Some people will experience crisis and some will not. Depends on 3 factors. And this is again from the transactional model. The appraisal, the perception that this person has of the event. Is it worth getting excited about? Or again, as a nurse, you might look at that and say, here's a natural or man-made disaster here, and I'm called to work, and I am really affected by this. But at this point, in appraising the situation, I can't let that get to me because I have to help others. The availability then goes to of situational supports, help from others. So the person, the victim in crisis, is going to need that. And here again, flipping it over to the nurse's side, we are that support. And by the way, we're also getting support from one another in the form of teamwork and working towards a common cause. That really helps. The availability of adequate coping mechanisms, and you're going to find this in terms of what makes a good crisis worker. But in the, sorry, that's my dog. I'm going to pause. And now I have to figure out where I was because my dog barks and I hear that. She comes loud and clear right through the headphones, like piercing your brain almost. So if she starts again, I'm going to have to pause. All right. The availability of situational supports, that's what we want to do, is look for that, and then the availability of adequate coping. So those 3 things are going to pretty much determine how we deal with the event. The last item there, availability of adequate coping mechanisms. So if you're a rather hardy individual and can take these little hits and stressors and anxiety spikes in our life, probably going to do better with this versus somebody who's frail. And look at our patients that have mental illness that already have their coping mechanisms really, really tapped, and they would be considered the frail. Those that have resilience and people that have, again, repeated exposure, unfortunately, to crisis and kind of bad things in their life tend to build up resilience, or they might get easily defeated from it. And again, if you don't have adequate, strong coping and a good solid ego, that might be the path that one falls through, is being easily defeated. And then positive coping, using positive coping versus negative. Now I know we all have our little choices in life on negative coping, and sometimes that really does help to get through the situation, but hopefully that doesn't turn out to be the problem, like an addiction or something like that. Okay, moving along. Okay, so after the crisis, this is what usually happens. So you see some time frames there, like 4 to 6 weeks. Okay, 4 to 6 weeks, it depends. Some people are more, feel the disequilibrium from the crisis, and then they're just, nothing's really feeling like the same. It just doesn't feel like your regular life. It says 4 to 6 weeks. Might be sooner, might be longer for some. The individual will return to mental health, develop new coping skills with that support and the ongoing efforts on themselves to get through the crisis. Or they may continue to decompensate. So this is the person that might be, quote unquote, sweeping the issue under the rug and not dealing with it. Crisis is gone, I put it aside, not going to deal with it. It might be the healthcare worker who's had to maybe just get through this crisis day after day after day after day and never really processed it. That person might decompensate somewhere down the line. In recovery, problem-solving skills are supposed to be learned. New perception of the problem is seen and support is given. And that person can check the box and say, I've been through this crisis, and guess what? The next crisis, they're going to have a little more skill there, getting ready for it. Because it's going to happen, and we know that about life, don't we? Types of crisis. So this comes from your book. You can go back and look for more definition in this and explanation. So I'm going to give you the quick one here. Dispositional crisis. So this is a response to an external stressor, situational stressor. So situation and the example here is a poor test grade, bad reaction, or like somebody, I've seen it. I've seen some people get really, really, really upset over some test scores, and it's definitely a crisis moment. And loss of job. Maybe somebody has lost their job and destroys property, or unfortunately, what we see might take it out in a homicidal rage. That's kind of almost become a little commonplace in our society. The next one is crisis of anticipated life transition. So thinking about your normal life cycle, we go through many transitions, and that are expected. But maybe, and so we anticipate that we're going to have some stressors around it, but when you add more things on top of it, that becomes a more profound type of crisis. And I give you the example of a quote of too much on one's plate, trying to handle too much at one time. So you might be working, going to school, handling children and a family. I don't have all that there. And then you know that you're going to have a new baby, and you now have to, you have too much on your plate, and it becomes very much a crisis, and you can't handle it, need support. And then crisis resulting from a traumatic stress. So this could be any type of trauma, and the example is rape or disaster. Or maybe your daughter trips and falls and hits her head and ends up with a concussion. That can be a traumatic event for some of us. Next slide. And the rest of the crises. So maturational developmental crisis. This is something that happens because that we are normally developing and maturing through our life. And sometimes those transitions can be really, really difficult and crisis-oriented. So I don't have this as an example, but if you can all dial back to junior high, big-time crisis in terms of maturation. Preteens, middle schoolers, they have a lot of issues. They have a lot of things they're dealing with. Their body's changing. It's morphing. Their whole thought processes are morphing. They're getting interested in relationships and more intimate relationships. It's just very confusing. And that can be a crisis. And the other ones, divorce happens, separation in a family, midlife crisis when men or women feel this need to maybe dial back the years, because I'm getting older, and that's maybe something I'm not ready for. Or even gender confusion, or not, it's sorting out in terms of gender identity and sexual preferences can be all very, very much crisis moments for people, especially when they're not getting a good support with that. In fact, they might be getting bullied over it. That adds to it. And then crisis that's reflecting psychopathology, just not able to, and that's your patients with the underlying psychiatric disorders, dealing with that, and then one little stressor causes an increase in the psychiatric symptoms, or perhaps some symptoms are getting out of hand, like voices and saying not to take meds, and therefore a patient will start to decompensate. And so that's the other and last type of crisis described here. So here's the crisis worker, and this is what I was saying in terms of, okay, you might be going through the crisis too, and you are now called into work, or you're volunteering to do this, and this is what one needs to be when dealing with crisis and individuals in crisis. So calm, good point, and empathetic. So using a lot of empathy, and this is where your verbal, nonverbal congruency really comes into play, because your words must match your own affect. You have to be objective, think very clearly, and this could be a challenge if you're dealing with your own stuff here. Identify the facts of what happened, and you have to be very objective, and this person's very emotional, and you have to remain objective and not match their emotion, but still be very empathetic. So it's very a great talent to do this. Aware of the cultural values, or the societal values. Might be, crisis workers fly into other countries and other demographic areas that they may not be familiar with, and they have to really kind of understand what the values are there. Crisis worker does not impose their own values or beliefs. Nobody does. In healthcare, I hope. Courageous, definitely courageous. Good listener and can tolerate uncomfortable feelings because of the sadness, the anger, the rage that one might feel. Commitment to individuals in crisis. And nurses may be called on to function as crisis helpers in virtually any setting committed to practice of nursing. So anywhere this can happen, that you are called forward to do this. In crisis intervention, the minimum therapeutic goal of crisis intervention is psychological resolution of the individual's immediate crisis and restoration to at least the level of functioning that existed before the crisis period. Not crisis like period, but the crisis period. Okay. That's a big goal. And so you can see that may not happen over a short period of time. That's going to happen over a period of time. A magic wand would certainly be helpful, but since we haven't found one of those, that's we really don't have a determination on that. A maximum goal is improvement in functioning above the pre-crisis level. This is where people actually learn from the crisis and bring that forward in their life as a tool. And it can be actually positive to learn from that. In the nursing process, we're going to start with phase 1 and look at our assessment. This is where information is gathered regarding the precipitating stressor and the resulting crisis that prompted the individual to seek professional help. If you go into the crisis skills lab that we did, you'll note that you were asked to bring up some helpful things that you would do in terms of intervening and the steps in which you need to apply to all crisis situations. And I'll try to remember to actually, if it's not here in these slides, I will make sure I get those answers from that skills lab up so you can see what I'm talking about. Okay, back to this. The nursing process, what are we doing? Phase 1 assessment and gathering information, finding out how that person is perceiving the event. What are their coping skills? This is the list I'm talking about from Skills Lab. In phase 2, planning of therapeutic intervention, from the assessment data, now we know kind of where we're going with this individual. The nurse selects the appropriate nursing diagnoses that reflect the immediacy of the crisis situation. So these can be, not all psychological or psychosocial type nursing diagnoses, but we've got injuries too sometimes, physical injuries, and those are going to maybe take precedence and need to get fixed first before we can actually delve into the psychological problems or nursing diagnoses. From that, then you will develop an outcome. And appropriate nursing actions are there selected, those interventions to match those outcomes that were developed. Okay, so some of the diagnoses here, these are psychosocial based, not based on what injuries. You'd have to wait for med surg for that. No, you can actually go and look at that yourself. Diagnosis is individual ineffective coping, ineffective family coping, and altered thought processes, because again, people are in panic, and if they stay there, they can't get out of there. They're going to start having delusions. They can have very distorted perceptions of the environment in the form of hallucinations. And then, of course, anxiety, and then we would label that as what level is it, and what level in terms of our outcomes do we want that patient to get to. Outcomes need to be realistic. Include the patient and the family. They have to be in the process of planning this because, again, they're in charge when you're not there. Patient is responsible for the problem solving. We can certainly help them create a list and we can prompt them, but we want them to come up with it because that's going to build their self-esteem and help them to get through this crisis. Phase 3 in the intervening, according to the plan developed in phase 2. And again, review your chapter. You can see all the many listed interventions there. I believe that's where you're going to find that list that I'm talking about for Nursing 235 in that case study we did with Carl and his family. Regardless, I will still put that up there. And then phase 4 of the nursing process is evaluation of the crisis resolution and anticipatory planning, which means basically you're reassessing and looking at the objectives. Were they met? Or do they need to be continued? Or do we need to maybe align a different type of intervention? Maybe the outcome's not right. Maybe it's resolved. All that comes in evaluation. And the text really goes into disaster nursing. Please look at that. It's going to be helpful because I think we're going to start to see more and more of those on the state boards. Okay, that's the end of my lecture. Hope you have a good day. Bye-bye.